I will just give you an overview of what's happening about Ebola outbreak in Africa. Overall, in two countries, they are Congo and Guinea. A total of 17 Ebola cases have been reported, with a total of 9 deaths, with case fatality rate of 53%. These outbreaks are not linked, for your information. In general, when we go to DRC, 8 confirmed cases and 4 deaths with case fatality rate of 50% have been reported into health zones in North Kivu. Bena health zone, 5 cases, 4 deaths. Katwa health zone, 2 cases with no deaths. And Musenene health zone is 1 new case reported very recently. So in general, in DR Congo, about, as of today, 956 contacts have been listed. 70% of them, 746 of them are under monitoring, under contact follow-up. 659 eligible contacts have been vaccinated. The DRC Minister of Public Health is working with partners, including Africa CDC, to establish coordination and response mechanism that will help to contain the outbreak as quickly as possible within the epicenter. In the Republic of Congo, 9 cases, 5 confirmed, 4 probable cases were reported with 5 deaths, with case fatality rate of 56% in 2 regions. It should be noted that last week we reported 6 deaths. The 1 suspected death was returned to be negative lab result. So we have now 5 deaths. 2 cases have recovered and has been discharged from treatment center, 1 in Conakry and 1 in Zorokore. To break down by health zones, Conakry reported 1 case, no deaths, and this case has already recovered. And Zorokore, 8 cases reported, 5 deaths, 1 already recovered and discharged. In general, the response in Guinea is, as of today, 382 contacts have been registered, of which 106 completed their follow-up and 276 are currently under follow-up. Over 11,300 vaccine doses have been delivered to the Republic of Guinea, and vaccination officially began on Tuesday, 23rd February. As of today, 51 eligible individuals have been vaccinated, 11 are in Conakry and 40 in Zorokore. The screening is in place at ports of entry, and investigation for the origin of the outbreak is ongoing with a review of medical records, registration books, and so on. So investigation is still going on to set out the origin of the outbreak. The Africa CDC supported this disease outbreak response. One, we established or activated our emergency operations center to manage or support, coordinate both disease outbreaks in DR Congo and Guinea. Our field team, advanced team in Guinea, is working closely with different partners and with the Ministry of Health to develop the National Emergency Response Support Plan, and also they identify the needs and gaps currently. And we here at HQ, from the preliminary report from the field team, developed our emergency response support plan for the whole region. So saying that as Africa CDC, we put forward as a guidance, at this time, the Africa CDC recommended the following to member states to enhance their cross-border surveillance across the region, map population movement to identify all potential crossing points where there is a risk of disease spread, set up a screening posts and conduct health screening for travelers with signs, symptoms of EVD and Ebola and so on. Implement public health measures at border screening points, including temperature monitoring, infection prevention and control, and share information. Information is really vital to curb this outbreak, and we need across borders, we recommend member states to share information across the region. Thank you. Back to you, Director.
So Wayne, thank you, and over to you.
Thank you very much, Doctors John and Merawi, for those really comprehensive briefings on the two epidemics that we're fighting, the COVID-19 and the Ebola outbreak. Now we are at the time when we take the questions from the media, and the first one is coming from Deborah Matabu. And Deborah says, I'm a reporter at the Sunday Mail newspaper, a weekly paper in Zimbabwe. And the question that she has, she says, how many African countries have started COVID-19 vaccinations, and which vaccines are they using?
So thank you for that question. First of all, let's celebrate the good news yesterday about the vaccines arriving Ghana from the COVAX facility. And the importance of that is that I have stated many times that COVAX represents a symbol of cooperation and global solidarity that we have always talked about. I think that has to be recognized. This in challenging times, like what we are dealing with, this pandemic now for the past close to 1 year and now 2 months almost, every little step in the right direction should be celebrated. So we really are happy with that. So with that said, which countries have started vaccination? Let me start from the south and move upwards slowly. A journey of 1,000 miles begins with one step. And that is the few steps that we are doing will hopefully add up in this pandemic. And we hope that in the course of this journey, we accelerate it so that we can be ahead of the pandemic. So South Africa has started vaccinations with Johnson & Johnson. You saw President Ramaphosa take the vaccine live. And then when you move up to West Africa, we now know that Senegal started vaccinating with the vaccines from China. Ghana received their vaccines yesterday, and hopefully they should start vaccination today. And then you move up north, you get Morocco and Egypt that have started vaccinating mainly with the vaccines from China. And then we also know, if you go eastward, that Seychelles had been vaccinating with the vaccine from China. I think those are the countries that I know. Now, Guinea, earlier on, we know that we did some very early vaccinations with about 60 people with a Russian vaccine. We have not heard more from and it is safe to leave it at that. We, Africa CDC, will be establishing a comprehensive mapping of who is vaccinating where and with which vaccine, so that you can each time go onto their website, click there and see how the continent is flooding. But again, as I said, let's celebrate these early steps. The vaccine situation scenario, we've all discussed it on this platform over and over, how challenging it is, the efforts that we are all doing. And I'm very pleased, personally pleased, to see that some of the movement have started.
All right, thank you. We go now to Eswatini, and we are joined by Bonisile Makubu from the Times of Eswatini. And she says, last week, His Majesty King Mswati III told the nation that he survived COVID-19 after using remdesivir, which he got from Taiwan. He then commissioned government to secure remdesivir for all Swazis to treat COVID-19. What is the Africa CDC's advice to Eswatini, as this drug has not yet been approved by the WHO for COVID-19?
So remdesivir has, as you recall, was one of those drugs very early on that was available for treatment of especially severe cases of COVID-19. And it went through the trial, the Solidarity trial And we now know, and that is very old news already, that it didn't really show any significant improvement when you compare those who took the drug and those who did not take the drug in a control trial. It didn't show any effect there. So that is all I can say with respect to that we should always allow science to drive our response to this pandemic. We shall only win if we use science-driven approaches that are backed with sufficient data to make informed decisions how to fight this pandemic. Anecdotal experiences would not help us. It will only just get us confused. I think that is what I will say at this point, speaking very broadly. I've not seen the situation in Eswatini. That is, I don't know the details of what you are referring to. So my comments should be interpreted very broadly, that we are giving general recommendations and guidance to our continent.
Thank you very much, Dr. John. We have Girum Chala, who has raised his hand online, and Girum is with CGTN, I believe. Please go ahead with your question.
Good morning, Madam Wayne and Dr. John. I would like to ask a very important question. I've been here in the United States for another assignment, and the situation of not wanting to be vaccinated across this country can be visibly seen. But the same inclination of Africans, like in Addis and other places, of developing some kind of phobia or mistrust towards the vaccinations, people saying we're not going to be vaccinated, is growing by the day. Maybe, I don't know if you have noticed it so much. So my question is, what is really the African Centers for Disease Control and Prevention going to do about it, with perhaps in collaboration with member states? And the other thing is, you said 60% vaccination is going to result in the most important herd immunity. And this attitude, isn't it a worry that it could affect your future plan?
So thank you, Guillaume, for those two very important questions. First of all, with respect to the first question on the acceptability of vaccines for the continent, and what I'm going to say aligns with my previous comments on that. We should use evidence and data to drive our struggle and fight against COVID-19. We, as Africa's CDC, took a very early leadership approach to generate evidence and science several months ago, and where we commissioned a large-scale study that included 15,000 participants from across 15 countries in Africa, 15,000. Never been part of any group that works every